Chapter 5, Attribution Theory. This video content is based on Introduction to Health Behavior Theory by Joanna Hayden. Let's explore a theory that helps us understand how people explain their successes, failure, and health choices. Attribution Theory. First is, what is attribution theory? Attribution theory explains how people interpret the causes of events, especially success or failure. The question at the heart of this theory is simple. Why did this happen? When something goes wrong or right, people want to make sense of it. Their explanation or attribution affects their future motivation and behavior. This theory was first used in education and sports, but is now widely applied in health behavior change. Second is the theory essence sentence. The theory essence sentence says there is a cause or explanation for things that happen. If we know what caused an outcome, we can either repeat it or change it. This applies to weight loss, quitting smoking, sticking to a treatment plan, and more. Third is locus of control. The first construct in attribution theory is locus of control. It refers to whether the cause is internal or external. An internal locus means the cause lies within the person, like effort, motivation, or skill. An external locus means the cause is outside the person, like luck, traffic, or family influence. Let's say someone misses a workout. If they blame themselves, that's internal. If they blame the rain or their noisy neighbors, that's external. Fourth is stability. Next is stability. Stability refers to whether the cause is consistent or changeable over time. Stable causes stay the same, like intelligence or genetics. Unstable causes vary, like mood, effort, or weather. For example, someone who fails a diet might say, "I've always struggled with weight." That's a stable attribution. Or they might say, "I had a bad week." That's unstable. Fifth is controllability. The third construct is controllability. This is about whether the person believes they can change the cause. Controllable causes are things like effort or motivation. Uncontrollable causes include chronic illness or a family history of disease. Controllability strongly affects motivation and stigma. If people feel they can control the cause, they are more likely to try again. But if they see it as out of their hands, they may feel helpless or even ashamed. Sixth is the attribution matrix. Let's put it all together. We can describe causes using all three constructs. Locus, internal or external stability, stable or unstable. Controllability, controllable or not. Here's how that looks in practice. Internal stable, intelligence, athletic ability. Internal unstable, mood, energy, effort. External stable, neighborhood safety, task difficulty. External unstable, weather, luck, daily traffic. Understanding where people fall in this matrix helps tailor behavior to change strategies. Seventh is application to health behavior. In health, attributions matter. They affect how people interpret illness, setbacks, and success. If someone believes they have diabetes because of genetics, they may feel it's beyond their control. But if they believe it's due to poor eating, they may take action, though they might also feel guilt. Attributions also influence how health educators design messages. Knowing what people believe causes a behavior can help change that behavior. Eighth is stigma and attribution. Attribution also plays a major role in stigma. When people believe that a health condition, like obesity or addiction, is controllable, they are more likely to blame the person. But if they believe it's caused by uncontrollable factors like poverty, trauma, or genetics, there's less blame. This makes attribution theory especially useful in public health messaging and intervention design. It helps us reduce shame, increase empathy, and promote realistic strategies. Ninth is strengths and limitations. Let's talk about strengths. Attribution theory gives us insight into how people process events and how those thoughts influence behavior. It's practical, adaptable, and helps shape supportive communication. But it also has limitations. It focuses on personal perception, not necessarily reality. And it doesn't fully address social, emotional, or environmental factors that also influence health behavior. That's why it's often paired with other theories. Finally, let's summarize the chapter. Attribution theory explains how people make sense of what happens to them, especially when things go wrong. Three constructs, locus of control, stability, and controllability, shape how people explain success and failure. These attributions influence motivation, effort, and willingness to try again. They also influence stigma, self-blame, and how health educators design interventions. When we understand what people believe caused an outcome, we are better equipped to help them change it. This video content is based on Introduction to Health Behavior Theory by Joanna Hayden. Thanks for watching, and stay tuned for the next chapter on the trans-theoretical model.